Hey, on today's Spinal Workshop, everybody, we are going to talk about something that is always near and dear to most people's hearts, especially if they want to sleep well. Have we ever heard of the Goldie Locks theory? Not too hard, not too soft, just right. Today's topic is choosing the right mattress. So tune in. I'm glad you guys are tuning in today. This class today about the topic, choosing the right mattress. It's an age-old question of, well, doc, what type of mattress should I buy? Should I buy this brand or that brand? Sometimes it's specific to just what's going on with your body. And a lot of times, unfortunately, we have people out there that are sleeping on mattresses that are 15, 20 years old. And no wonder they're dealing with lower back pain or maybe neck pain or hip pain. So let's dive into these different, crunch down, plush. Oh, the word plushier comes up in this topic today. Plushier. I have a hard time saying that word. So let's think about the fact that there are a lot of people with lower back pain. And patients with lower back pain, well, we're suffering with this pain, and often we're wondering, I can't sleep because I can't. It's so uncomfortable. So folks suffering from lower back pain most often prefer beds that are firmer or more firm. One study purported that hard beds should be the first choice for low back pain sufferers. The recommendation is not only that you should sleep on a rock-hard bed. That's not what we're talking about here. But rather, it's the need for support. A firmer bed prevents the lower back from sinking deeply into the bed and irritating the facet joints. Where the two vertebrae are meeting together, that's called a facet joint. Higher-end luxury beds can provide plenty of support along with comfortable padding, while lower-end discounted beds can provide the firmness, but with less comfort. Short story, one time we purchased in a pinch because we needed to fill up a guest bedroom in our home, and we purchased a mattress and a box spring from a box store, okay, without saying their name. Folks, that was the most hardest mattress I ever laid on. And I would not want that for anybody else because I don't suffer from, major issues of lower back pain. But because of cost and the need at that point in time, that's what we did. I don't recommend that for everybody. As we're saying, for some folks with lower back pain, a more firmer mattress is needed during that time to help their bodies recover. How about the next category? We have folks not just with lower back pain, but what about upper back neck pain? Patients who suffer from upper back and neck pain often prefer a softer or, there's that word, plushier bedding. The plushier cushioning in the bed allows for the head and thoracic area to sink into the bed to support the cervical area, the neck. A pillow top mattress or one with softer foams, padding, and quilting can be a good recommendation. There are also several types of pillows that can provide extra support for the neck. There's a lot to choose from these days, and that's why we go back to the old nursery rhyme of the Goldie Locks theory, the three bears and Goldie Locks, not too hard, not too soft, just right. It's a process, folks, but at least I'm giving you some information. If you are dealing with lower back pain, you may need a firmer mattress. If you're dealing with upper back neck pain, you may need a little bit more softer support, or the word is plushier. How about those that are dealing with arthritis or even fibromyalgia? Patients suffering with multiple joint pain areas often prefer bedding with cushioning that disperses, that gets spread out with weight across the greatest body surface. Frequently, such patients also have spinal complaints. Balancing cushioning with proper support for the spine requires a higher-end mattress. Yeah, you're going to spend a little bit more money. Since fibromyalgia is related to stress levels, it also is important to review pre-sleep rituals with patients. What do we need to do to get ready for bed to help you relax and before you're going to bed? Pre-sleep rituals. Sometimes I just want to go to bed. I don't think about those things that I need to do to prepare myself to sleep. Maybe stop eating, maybe no drinking of caffeine, maybe we putting on a certain bedclothes to wear to bed, maybe the temperature in our bedroom of where we're sleeping. How about stomach sleepers? Wow. Did you know that sleeping on your stomach in a soft bed can stress the lower thoracolumbar, so that's like where your rib cage ends, and then you have your lumbar spine. The weight of the belly and the pelvis also compress the bedding to provide support to the stomach, the pelvis, and the thoracolumbar areas. A firmer mattress is actually necessary in this point as well, because if we're sleeping in a hammock type, laying down and our belly dips in there, that lower back is not supported, and thus those facet joints are getting jammed up and we're experiencing more lower back pain. And that's why we also not push against, but suggest not sleeping on your belly. You may say, Dr. Joe, what about I sleep on my side? So if you're a side sleeper, which is an estimated 73% of the population sleeps on their side. That's a lot of folks. A plush mattress is often recommended for side sleeping because it provides the best way to maintain the natural shape of your spine and the curves of the hips and shoulders while you're sleeping. A plush bedding will cradle the body and help disperse the weight of your body across the maximum surface area. Instead of creating pressure points at the hips and shoulders, special pillows may also be necessary to support the neck in the position parallel to the ground. So, in other words, we don't want you sleeping kinked like this. We need that head level. And if your shoulders are pressed in there because of that plushier bedding, well, we want to make sure we have that level playing field for your neck to not get pinched and those nerves being irritated. And then you wake up and those muscles are all tense and tight. So there are choices that need to be made. And especially our seniors. Most seniors grow up sleeping on extremely stiff beds because that's what manufacturers made during that time of their development and growth in life. Having slept on a firm mattress their entire lives, many prefer firm bedding. Even their health conditions indicate that plushier bedding would be better. But some education may be necessary. We may need to stop, pause, and talk about these things on a one-on-one basis to convince our seniors of needing a change in their mattress. Folks, there is no one-size-fits-all. And it is a process to finding out, again, 3 bears in the Goldie Locks theory, okay, of what's going to work out best for you and your condition in this, slumber. We want you to sleep well. We need your body to be well rested to deal with the stress of the next day that comes at us. And when we're dealing with lower back pain, if we're dealing with neck pain, if we're dealing with arthritis and maybe a lot of muscle aches because of fibromyalgia, and we're not sleeping well, you're not rested to handle the next day of stress that comes at you. If this information is helpful and you need a little bit more education on helping to pick these things out in the right way, or even how about seeking chiropractic care to address these areas, the lower back pain, the neck pain, the arthritis, the fibromyalgia, there's a lot that goes on. We want to make sure you're well adjusted, and, well, I want you to get adjusted today. If this is something that is resonating with you and you need a little bit more information, get in touch with us at BafilleFamilyChiropractic.com or BafilleFamilyChiro.com, or give us a call at 570-788-3737. Like and subscribe to our channel here on YouTube, or even our Facebook channel, our page there, to learn more information that we love to share. We appreciate you all, and we hope that to connect with you more deeply, and hope that you get a good night's rest. Choose the right mattress. Thank you.